All right, so mentoring. Let's talk about it. Obviously, this is something I've been highly passionate about for a long, long time. We've got to a point now where I think pretty much got it all figured out in terms of how we want to go about introducing mentoring. We've got a couple of different options here for you. Okay, so the first one, and how we usually start off our mentoring, it's one-on-one. This basically means we either do a consultation over the phone, Skype, or sometimes we might even use the Zoom software as well, so we can actually talk to each other over the internet, or it's a phone call. Usually about an hour. We try and sit down and discuss what things you actually want to do and what things you want to achieve. Because the one thing that I know about mentoring thus far is that it's completely individual for every person. Okay, I try to sit down and work out programs, but it doesn't necessarily work. And I mean, that's no disrespect for people out there that do have programs. I think there is definitely a place for that. But I don't want to work on that level. I need to work on a level in regards to working with people that really want to achieve and have clear and specific goals. But sometimes they don't have those goals. They have an idea. So that's what we tend to try and flush out in our one-on-one mentoring. And it's a great place to start, because for a lot of therapists, depending on where they are in relation to their career, it varies so much more. So if you are just starting off, then your goals are going to be completely different to, say, the therapists that are actually working in high performance as well, which I've done a lot of, but they want education and understanding in a completely different set of fields. So they have completely different objects. So it does vary so much, you know, and I get people wanting to be mentored on a whole range of things. I've got therapists who want to be mentored. They want to go to the next Olympics with the Olympic team. Okay, well, that starts a good maybe sometimes 7 years beforehand, depending on where you are in that journey. You may be further on, so we look at whether or not those options are available or what you need to do to achieve that. And it doesn't always happen for every person, because there is so many things that you do need to do to tick those boxes. If you are just starting off, then obviously the one-on-one is going to be huge, because the first thing you want to do is build your reputation. And how do you build your reputation? How do you get it out there? Well, you be good at what you do. It's simple as that. Just be awesome at what you do in the clinic, okay? Yes, there are other things that you add in, and I can certainly help you be awesome about what you want to do in the clinic. If we go to the next level, which is, as far as I'm concerned, it's the gold standard, okay? This is where I do exclusive visits to clinics, okay? I've done a couple in interstate with a couple of different clinics where I sit down with you in your clinic with your clients. You may be a sole practitioner, you might be involved in a multidisciplinary clinic, I don't know. We need to work out where your role is, what you're doing, and how we can better serve you and how you can function better as a therapist. It's as simple as that. Okay, so we can get a look at your environment, we get a couple of your clients in, that would be great. We can go through some treatment strategies, you can show me how you work on them, I can give you the benefit of my experience, and then you can understand how you can put it, because I know and I hear and I've seen so many therapists over so many millions of conversations, it feels like sometimes, is they go away to these workshops. The difficult thing is that they learn all this stuff, but they come back and they just can't assimilate it. You know, it's really difficult to do. I just got to cut through that BS, get to your clinic with you, with your clients, and have a look. And then we can educate and mentor you through that process. There is nothing more exclusive than that. Okay, so that's simple. We also have, and I have the opportunities which I've been doing for quite a lot of years, and that's where you visit me at my clinic and I can run you through a whole range. Now, we do it half day, sometimes we do it full day, it depends. Sometimes we get groups of practitioners that want to come down and learn something specific, so I certainly offer that. That's not a problem whatsoever. Once again, we start off with a one-on-one, we work out what you need, so it may be treatment based, it may be NAP protocols for the hip, it could be NAP protocols for the knee, it could be NAP protocols for the shoulder, it could be whatever the case may be, but that's what we do. We individualize it. And then finally, something in the really, really new area, and that is obviously sporting mentoring. So that's where I'm going and traveling and working with either people who are working in sporting groups or sporting organisations, whether it be amateur or elite. So there may be a group of therapists that actually want me to come in and say, how can we better function with this sporting group? How can we as therapists take it to the next level for them? So obviously a lot of that's being done at a higher level, at an elite level. So the opportunity is that we're doing some of this overseas, but we'd certainly love to be able to do it here in Australia. So if you know of anyone that's working within these frameworks, if you know and you're reading this now and you're watching this, this is how our mentoring program runs.